I'm Matt Willis, Public Health Officer for Marin County with the COVID-19 update for June 26th. Today has been an important day in our response. It's the first time in our progression of reopenings over the past 2 months that we're choosing to delay our reopening based on increased incidents in our community. We'd planned to take a big step forward on reopening this coming Monday. Instead, we're taking a smaller step. We're going to pause on a few of the business types that had been slated to move forward. Indoor restaurants, hair salons, and barbershops are still on deck for Monday, but gyms, personal services, hotels, and short-term rentals will be paused for now. Here's why we're tapping the brakes. Yesterday, 54 new COVID-19 cases were reported, which is the single largest number on any day so far. In addition, there are 12 COVID-19 patients hospitalized in Marin and 5 in intensive care, which are our highest numbers of both hospitalizations and ICU patients. This corresponds to spikes seen across the state and region. Today, San Francisco and Contra Costa both announced that they'll be pausing on reopenings that had been scheduled for next week. We've been talking all along about how we'll be using data to guide these decisions. And these patterns we need to pay attention to. We've significantly increased testing, especially focusing on communities at risk, and this is driving up our case numbers. But we know these case rates are not due to testing alone, because we're seeing the percent of positive tests remains about the same despite increased testing, and we're seeing more hospitalizations. Compounding this problem of transmission within our community is an outbreak at San Quentin Prison. While this is a sequestered and distinct population of almost 4,000 inmates and 1,000 staff, it's still part of our county. San Quentin is experiencing the largest prison outbreak of COVID-19 in the state, with nearly 600 cases among inmates and 75 among staff in just over 2 weeks. This has stressed local hospital capacity because at least 25 inmates have required hospitalization within the region. These are not easy decisions, and we've been clear that the reopening process will be sequential, gradual, and data-driven. Taken together, the spikes in cases statewide, regionally, and in our own community, increased hospitalizations and ICU stays, and a large prison outbreak that is still uncontrolled within our borders, we need to take a more cautious approach for now to follow emerging trends over the coming days. None of this changes our basic messaging. Our ability to reopen still depends so much on your behavior. We can flatten the curve with very simple measures. If we all cover our faces and practice physical distancing, it's very difficult for the virus to travel between us. So thank you for doing your part.